This is a very good question about inpatient and outpatient. Residential treatment is not inpatient. Inpatient treatment is very important. It's all about safety. You are struggling. You're not able to. You don't feel safe. You may have thoughts about harming yourself. So you go inpatient. It's usually a locked unit, and you're there for stabilization until you feel safe, and you are able to leave and get treatment. A residential program is really a program in a home-like environment, where patients come together with similar struggles, and in many ways, most residential programs have at least 4 hours of exposure and response prevention a day. And as I know now, there are 3 in the country. There's one that I'm the director of, the Houston OCD program. There's one at McLean Hospital in Belmont, and one at Roger Memorial. And they all are very good programs, but they offer residential treatment. In a residential program, you get at least, let's say, 4 hours of exposure response prevention. Plus, you get a lot of groups that you can go to and learn about what triggers OCD, cognitive behavior therapy for OCD, relapse prevention, self-compassion, some other things that contribute to overall well-being and may enhance the quality of life as your OCD symptom reduce. What I found in my experience about working in residential programs is a big part of it is the milieu, or the camaraderie, or the support, or the kind of creation of hope and belongingness. And through that enriched connection with other patients, you begin to do work that you would struggle with in isolation alone at home. So we have a lot of groups in the programs where we really enhance and focus on supporting patients in getting better. For example, once a week in the Houston program, patients get together, they review how successful they have been, and they set goals for every week, and the community gets together and support each other both throughout the week to meet the goals and then review them together. And then when they're doing the exposure in the evenings, for example, or there's a lot of staff support that's not available when it's not residential. What's appropriate treatment for a person struggling with OCD, and how do you know the difference? Most patients, by far most patients, benefit from outpatient therapy, and that is all they need. Focused, high quality, with a well-trained therapist through outpatient. Let's say roughly about 80% of patients with OCD benefit from that level of treatment. I'm saying that let's call it roughly 20%. A significant number of patients do not benefit from outpatient. They would benefit from partial hospital, intensive outpatient, partial hospital. This is kind of like a day program. You come in for 4 to 6 to 7 hours a day, or residential where you're there 24/7 and you get support. And the reason when the patient knows what level of care to go, it's really how are you benefiting from treatment? How severe is your OCD? Some programs use a cutoff of standardized measures such as white box or Yale Brown obsessive compulsive severity scale. And if you're in severe or extreme range, you may benefit from residential or partial hospital. But it really is about giving outpatient therapy a try and collaboration with your therapist. If it's not working well enough or fast enough, or you have really challenging time completing the exposure or the treatment work, there the residential or partial hospital program might be a really good alternative. And the effectiveness of residential and partial program is very impressive. It's really at par with outpatient. So patients that fail the outpatient treatment and then come to a residential program, they're just as effective as had they gone to outpatient and benefited initially.